Hello, I'm Darren Magee. I'm a therapist. I'm based in Belfast, Northern Ireland, and this is my first YouTube video, so please be kind. For my first video, I would like to talk about what seems to be the only topic of conversation on the news these days, the only news agenda, and that is COVID-19, coronavirus. But I would like to talk about it from a mental health perspective. Now, we have heard on the news quite a lot about this being an unprecedented situation, and we hear it so much. It's like a lot of things. When we hear words like that, we hear them so much, they tend to lose their potency. We tend to stop hearing them. But the thing is, these really are unprecedented times. Unprecedented in the sense that we have no frame of reference for this. Certainly not within living memory anyway. What's going on at the moment isn't just in our house. It isn't just in our street, our town. This is global, and that can be hard to take in. You see, I tend to think that we are social creatures. Social creatures in the sense that we like to fit in. We like to be accepted. We like to mix with others. We like to connect on some level. We like to be mentally and emotionally stimulated. And where we are at the moment, that, albeit it hasn't stopped, it has certainly been curtailed. Now, we can still connect with others through telephone, video calls, social media, things like that. In a lot of ways, we had been doing that already. But the fact that maybe that's all that we can do at the moment is maybe adding to that strain. So the current situation has brought up a lot of stress and anxiety, a lot of strain. Now, as uncomfortable as this may sound, I would say that's pretty normal. Who wouldn't be stressed at the moment? Who wouldn't be feeling a level of anxiety at the moment? We're actually meant to, but only really in short bursts. We can feel anxious or stressed, for example, if we have a job interview. We have that stress of having to prepare for it, have the right answers, the information, be able to give examples and so on. We also have the anxiety of whether or not I will get the job. That's perfectly normal. But there are some situations whenever we're feeling something that we really don't like to feel, stress, strain, guilt, shame, worry, fear, anger, all those things we don't like to feel. I often think that it might not be our only strategy, but certainly the first one we go to is, what gets me out of this? How do I avoid this? Sometimes the question to ask is, what gets me through this? Now, when we feel stress is our way of saying, this is important, I need to focus on this, I need to give this some energy. Whenever I feel anxious, it's my way of saying, I need to be ready. There's something's happening or something's going to happen. I need to be ready for it. I need to be on my toes. But when you look closer at these things, because I think they're very general terms, someone says, I feel anxious. We know what they mean, because we all feel it. But when we look a bit closer to it, something like anxiety, for example, anxiety is feeling a lack of control over something really important to you. It's feeling uncertain. It's feeling helpless. And given the situation at the moment that we're in, we may be feeling all of those things, probably a lot more. We're concerned about our health, the health of those that we love. We're concerned about our jobs, our financial security, our future. Again, as uncomfortable as it is, who wouldn't be feeling these things? Also at the moment, we're going through a period of adjustment. And adjustment itself can bring a lot of stress and strain. It can sometimes, again, bring up that feeling of a lack of control, or perhaps as if we're being controlled. But the thing to remember is, this isn't forever. This is for now. Sooner or later this is going to pass. Sooner or later we're going to get back to normal, or some level of normality, or perhaps even a new normal, in which case we're going to have to adjust again. Now, when we're at our most anxious, I often think when we're at our most anxious, you see, our brains don't like things that don't make sense. So whenever we're at our most anxious, we're perhaps ruminating over something from yesterday. We're playing back conversations in our head. We're replaying situations, scenarios. We're trying to fill in the blanks, make sense of something. Our brains might be thinking about tomorrow. We could be risk assessing, mitigating, trying to cover all the bases. If this happens, then I will. If that happens, then I will. We're trying to give ourselves a sense of control. Sometimes we may even be in someone else's head, trying to figure them out. What are they going to do next? What did he say to him about whatever? What are their motives? What is their agenda? One way or another, our mind is all over the place. But the distress we feel it right now. So it's right now that we deal with it. Well, if we look at, let's say, control. Okay, don't have a lot of control at the moment. I don't have a lot of control in the sense that I can't control when I go out or where I go. I don't have a lot of control over my job situation. I don't have a lot of control over fill in the blank. Okay, so what can you control? Because I often think it's the things that we really don't have control over are the things that cause us the most distress. For example, we can't control the past, as in we can't change it. We may rewrite it, we may ignore it, but we can't change it. We can't necessarily control other people. I think the most we'll ever do is influence them. Let's be honest, look how hard we try sometimes. Look how frustrating it is when they try and control us. So what can we control? Well, the situation we're in at the moment, we can control our diet. I know a lot of people, myself included, seems to have put on a pound or two since this all started. I think the last time I was at the fridge, I could have sworn I heard it say, "What is it you want now?" We can control our diet. Perhaps now, the space that we have, the situation we find ourselves in, perhaps we can control our diet in the sense that we can be a little more creative. We can learn to cook new dishes. We can at least try something new. If we're going to snack, we can control what it is we do, how much, how often. Perhaps a healthy alternative. There's nothing wrong with alcohol, crisps, chocolate, things like that. Nothing wrong with them, but just like before the lockdown, in moderation. We can control who and when we contact, how we contact them. Telephone, social media, video call, because it is important to stay connected, and perhaps the situation we're in at the moment, we can find ourselves connecting, perhaps even reconnecting with people that we haven't with for a long time. We can rebuild relationships. We can control the structure to our day. Now, if we're working from home, if we're having to work from home, is it possible to maybe have a workspace somewhere? You'll work between 9-5, have a break or two during the day, whatever it is, and as soon as you're finished work, you can close the door. That's the workspace. You don't go back there till tomorrow. We can set little tasks for ourselves, have a bit of structure in the sense, have a project to do, a book that we want to start reading, maybe one we've always meant to read, never got around to. We can perhaps learn a new skill, a new hobby of some kind. We can perhaps be doing some of those jobs we've been putting off around the house. Getting up at our normal time, getting dressed, getting showered, all those things, starting each day, as we always have done, can help have a structure to the day. If you're sharing a home with others, remember, you're going to need your own space. You're going to need your privacy. You're going to need that room to reflect, to be creative, to recharge. But remember and respect that so do the other people in the house. It's probably not a bad idea to stay informed about what's going on with the whole coronavirus situation. But staying informed, listening to the headlines, listening to the news at tea time or whatever, probably not so healthy to be glued to the TV 24 hours a day. Probably not a good idea either to be listening to the self-proclaimed experts on social media, the people that claim that there's aliens and government conspiracies and, if you put a hairdryer up your nose it'll cure everything. That sort of information is probably not so helpful. The little things you can do to ground yourself, to bring yourself into the moment. Because, again, as I said earlier, whenever we're at our most distressed, our most anxious, our mind is all over the place. But whenever we're focused on something in the here and now, this is where things like mindfulness can be useful. But we don't always have to meditate or do an exercise of some kind. Just having something to focus on right here and right now can help reduce our stress levels. And thinking about where we would like to be this time 6 months from now, this time a year from now. Imagining ourselves looking back at how we handled this situation can also help us. As this is my first video, what I would like to be doing is I would like to be talking about subjects that you are interested in. So what I would ask you to do is you can contact me by email or you can put any comments or questions in a little comment box below. Any subject you might want to discuss, you might want me to give an opinion on, or maybe you want to talk about. Things like addiction, anxiety, stress, relationship difficulties, narcissism and abuse, things like that. If you ask me those questions, I will always endeavour to get back to you and I will cover them as best I can, not just from my own experience, but I will be backing up whenever I can with the research that supports it, okay? So, until next time, stay safe, stay well, and I'll see you soon.